Good evening. My name is Corey Nettles, and I am Chair of the Board of Trustees for the Medical College of Wisconsin. We're so pleased to have you join us this evening for our second town hall. Obviously, we're facing unprecedented times all across our country, across our world, and certainly here in our community. The impacts have been felt closest to home. In these difficult times, I personally am happy that we have the Medical College of Wisconsin as a staple in our community. So an organization that I consider to be our trusted advisor, providing us with good, actionable information, being a single point of truth as we're all trying to make our way through these uncertain times. We view it as our responsibility as a community asset to provide real-time information and facts and data about what's actually going on in our community and what are the things that we can be doing to make ourselves safer as we work our way through this. Toward that end, at this second town hall, we have a real strong panel of experts that I'm really excited to have you all hear from, that I'm excited to hear from. They include Dr. John Raymond, who is the President and CEO of the Medical College of Wisconsin, Dr. Joyce Sanchez, who is an infectious disease doctor and an expert at the Medical College of Wisconsin, Dr. Ian Martin, who leads the emergency department at Frederick in the Medical College of Wisconsin, and we also have our health commissioner, Dr. Jeanette Kowalik, who's here representing the Milwaukee Health Department. So again, we appreciate your being here. There will be opportunity for a Q&A at the end, so we encourage you to use your chat button and start getting your questions in throughout, and we'll answer those toward the end of our presentation. Dr. Raymond?
Thanks, Corey, and thanks to everybody for joining us tonight. We want to leave as much time as possible for questions, so I and Dr. Sanchez and Martin will quickly run through 7 slides so that we all have a common understanding for the questions that you will ask. And then after that, Dr. Kowalik will give a health department update, and then the panelists will be available to answer your questions. We ask that you please submit your questions through the chat box, and Eric Johnson will read them out loud and direct them to one of the panelists, and we'll answer as many questions as we can tonight. So on the first slide, we just want to talk a little bit about coronavirus. It's very serious, and it can infect people regardless of age, or where you live, where you work or play, or even your underlying health conditions. Anybody can get it. The virus spreads the same way for all people, and that's through droplets that we make when breathing or talking, sneezing, or coughing. And those can be passed on to other people by breathing the droplets in or by touching an object or a person who carries those droplets. Next slide, please. Coronavirus is 10 times more deadly than the flu. It's highly contagious, it spreads easily through touch, and primarily enters your body from your hands, through eyes, nose, and mouth. And it's being spread in many communities across our country, and not just by people who've traveled, really by people who you interact with pretty much every day in your normal circumstances. Individuals can have the disease and spread it for up to a week without feeling sick or even realizing that they're contagious. Next slide, please. I want to talk just briefly about the state of the coronavirus spread in Wisconsin. As of today, April 6th, we had over 2,000 cases. There's a daily growth rate of new cases of about 13.4%, and that's actually dropped quite a bit from the last 2 weeks. So we're glad for all the work that everybody's doing to socially distance and stop the spread of the disease. As of today, Milwaukee had 1,256 cases with a daily growth rate of 13.5%. Again, that's less than half of what we had a week or 2 ago. So it's really good work that everybody's doing. We want to thank you for it and stress that we need to continue to work hard to stop the spread. So I'd like to turn over now to Dr. Sanchez.
Thank you, Dr. Raymond. If you move on to the next slide, I'm going to discuss a few things that you yourselves can be empowered to do in order to break this cycle of transmission. The first is to maintain a physical distance. I know we use the term social distancing, but I like physical distance. It sounds a little bit more obtainable. We say at least 6 feet away from others. That's mostly because that's the level of distance that it takes for droplet to spread, up to 6 feet on a cough or sneeze. Cleaning your hands often is the staple of infection control, both in our hospitals and in the community. So washing with soap and water, it can be any soap whatsoever for at least 20 seconds, or using an alcohol-based hand sanitizer of at least 60% alcohol or more. Maintaining distance is especially important from those who are sick or showing symptoms, although coronavirus can potentially be spread before you have symptoms. So if you're involved in anyone's care, either at home who may be sick, hand washing is going to be the most important tool in your toolkit to maintain healthy and to prevent spread. Next slide. So the CDC, or the Center for Disease Control and Prevention, came out with a recommendation of wearing masks by the public, and that's been supported by the Medical College of Wisconsin. We generally recommend that the public wear a cloth covering their face as a barrier, and that's mostly to protect people who you are coming into contact with, who you may cough or sneeze on, even if you don't have obvious symptoms that could be consistent with coronavirus infection. It's important that this cloth cover both your nose and your mouth, and to wear the mask when you're especially in close distances within that 6 feet, but it's important to keep it on even if you're more than 6 feet. Hand washing is important both before you put on the mask as well as when you remove the mask, because as you remove and put on the mask, you're using your hands that could be contaminated. So ensure that they're clean before you touch them to your face. And I again empathize, do not touch your face here. And I encourage you to try to use this mask protective wearing as a reminder, as a cue, as a nudge to keep your hands from your face. The last point I want to make is some of the hospital grade surgical masks, or the N95 respirators that you may have heard about, or face shields, should be reserved for healthcare workers and first responders, really our first line staff who are with boots on the ground, who are in the hot zones, who are taking care of the sickest of the sick. And with that, I'll turn things over to Dr. Ian Martin.
Slide 6, please. Thank you, Dr. Sanchez. So it's important to know the signs of COVID-19 infection to help stop the spread. Most commonly, symptomatic individuals experience fever, cough, and trouble breathing. Importantly, though, some people show no signs whatsoever of infection early on or at all. And because of this, it's critical to keep your distance from other people. And by doing so, you will protect yourselves as well as those around you. If you're worried you have COVID-19, call your doctor first. Do not have a doctor, call the city health department at 211. Please do not go to an emergency department or clinic before talking with the doctor or nurse for advice on whether you need to be tested and to where to go for a test. Importantly, calling ahead allows emergency departments and clinics to take precautions to prevent other patients and healthcare providers from getting infected. Next slide, please. Unfortunately, ingredients for the COVID-19 test are in short supply. Companies around the world are working quickly to make more tests. In the meantime, hospitals, clinics, and health departments have to prioritize how we use these tests. So first priority goes to hospitalized individuals and to healthcare providers who have symptoms of COVID-19. Second priority goes to patients with symptoms in long-term care facilities, to those 65 years and older with symptoms and underlying conditions, and to first responders with symptoms. Third priority goes to anyone with symptoms. And last priority goes to individuals who have no symptoms whatsoever. Fortunately, vaccines are in development, but not expected to be approved and broadly available for 12 to 18 months from now. In the meantime, several therapies, both new and old, like hydroxychloroquine, azithromycin, and others you may have heard of, are being investigated to see whether they will be effective and safe in the treatment of COVID-19. Thanks. Dr. Kowalik.
Good evening, everyone. So as noted, there was a lot of information that was presented related to what is COVID-19, the symptoms, ways to prevent COVID-19 from the health department's perspective. And again, just a little highlight here that it is National Public Health Week, and shouting out all of the public health workers that work hand in hand with our medical providers, working to focus on surveillance and technical assistance and support that we provide all over the world. So I just need to put that out there. But looking at COVID-19, I want to talk a little bit about how this started and where we're at. So our first case was detected on Friday the 13th last month, the month of March, and looking at the weeks and how quickly this grew. So for week 1, we had 73 cases in the city of Milwaukee. And by week 2, that amount had increased to 237, which equals about a 325% growth rate. By week 3, we had increased to 367. And part of the reason for that increase that's not as severe was related to some of the changes in the testing criteria by the state. Really looking at how do we triage and make sure that those that really needed testing got the tests. So one of those important testing changes was related to people that were in a hospital and people that were healthcare workers getting tested. And those were tier 1 and 2 tests. The increase for week 3 was 367, so that ended up being a 118% growth rate. And then week 4, which is what we're in now, the new cases right now were 490. This was as of the end of last week, and that equals about a 72% increase. So you see a little slowing there. Again, there was another change in testing criteria, but at this point in time, the testing criteria changes were related to some feedback from healthcare providers and public health, including law enforcement, because a number of law enforcement and first responders, including fire and emergency medical technicians, were being placed on quarantine for being exposed to patients and not necessarily knowing that they were infected with COVID-19, but say they were responding to cardiac calls or stroke or something of that nature, and then they needed to be placed on a 14-day quarantine. So we noticed that that was causing a number of issues for our first responders because we need them to be able to provide service, but if many of them needed to be placed out of service due to exposure to COVID-19, of course, that's best practice. It's very important to do that, but we also wanted to make sure that those people were getting tested and being placed back online if possible, knowing that sometimes when someone tests, depending on their immune system, they might show up as negative in the beginning stages of being exposed, but then later in the course of the incubation period, they may show up as positive. So we were aware of that, and are aware of that. I also want to highlight how COVID-19 is moving throughout the city. Initially, when we had our first wave, most of the cases were among African-American middle-aged men. But now that explosion of cases is pretty much all over. However, African-Americans are still the majority of cases, so about half of all cases, noting that the population for African-Americans at the county level is about 27% and at the city level about 37%. Another concerning rate is related to hospitalization, where we're looking at overall the amount of people that are needing hospital services related to COVID-19 infection was 17%, but that increased to 28% as of late. And the African-American rate is 62%, which is extremely high. And then as far as the death rate, as of now, we're at 46 for the county, and that's about 38 for the city. The death rate is about 80 for the county for African Americans, and for the city, it's about 87.5%, which is extremely high. And this has been getting a lot of attention because the city and the county of Milwaukee have been tracking race and ethnicity from the start, and many other jurisdictions have not focused on that for various reasons. We understand sometimes race and ethnicity data is not translated between the EMR, electronic medical record, to the lab, to the Wisconsin Electronic Disease Surveillance System. We also know that sometimes people do not report their race or ethnicity for fear of being discriminated against. So we're working to gather some of the unknown or missing race and ethnicity variables to have a more complete picture. But we are committed to showing this information because we want to truly see how is COVID-19 moving throughout the community. What can we do to reduce the spread? Whatever outreach activities, whatever practices we can help to improve. So it's important for us to stay abreast and to continue to make adjustments along the way, because COVID-19 is novel after all. So we have to be mindful that we're being nimble and making changes along the way. What we thought worked last week is not working today. So just like adding the mask guideline, that can change in another week. So we just have to continue to provide information as much as possible on a more frequent basis, which is why I'm grateful for being invited to this panel. And the Medical College of Wisconsin has continued to be a leader, and having a forum like this on a weekly basis is very important. So thank you.
Great. Eric, have you received any questions yet from the attendees?
We sure have. We've got a couple dozen waiting, and as I've been working with my team on the back end here, trying to sort and prioritize a little bit, it's clear that masks are a very hot topic. So I'm going to start out of sequence with Kurt's question, who was a former participant in one of last week's town halls, it sounds like. Kurt asks, last week on this chat, we were told masks were not helpful. Now the CDC is requesting everyone wear a mask when going outside. Which one is true?
I'll take a stab at it. I think they are helpful, and I believe that I said last week my personal opinion about having face coverings in public, that it was a good idea. I think just common sense tells you that it's a barrier to prevent the spread of the infection, and it just took a while for us to catch up with that common sense.
And I can add to that too, is personally, I have started wearing masks, at least traveling at the end of last year. But now, whenever I go out, I've always worn at least a surgical mask and then a cloth mask over that to protect myself, since I'm more at risk for complications from COVID-19. But this plays into what I just talked about, how things are changing quickly. So 1 week, we may say this is what we're recommending, and then the following week we're going to give you something different. It doesn't mean we're not aware of what's going on or anything to that nature. It's just this is a new strain of coronavirus, so we have to be flexible and provide information as we receive it.
Absolutely.
Thanks.
Great answers. I'll ask one that was asked before the webinar now. Millie asked, how long do you anticipate the quarantine to last?
I'll take that one too. It'll last as long as our governor and legislature or the municipalities decide it's going to last. What I can tell everyone is it looks like we're going to have the peak here in Milwaukee and probably in other parts of Wisconsin within 7 to 10 days. And that we hope after that we'll start to see some decrease in the number of cases. And we hope that that'll happen before our ability to give intensive care unit care or give people ventilators will be exceeded. So what I'd say, you're probably going to need to carry this on at least 2 weeks after the peak, from a public health perspective, if you want to continue to slow the spread. What do you think, Dr. Kowalik?
Oh yeah, I just saw the bad news about the Supreme Court ruling about the election. My public health colleagues and I have felt very strongly that the election should have been delayed weeks ago. Again, we just got our first case on the 13th of March, so that didn't give us too much time. We set a plan for an election, but congregating, bringing so many people together, and now we have these consolidated polls. We have 5 in the city of Milwaukee, is going to create more opportunities for exposure to COVID-19. We also are aware that there are individuals that are afraid to come out and vote, and many people that are over the age of 60 who are more at risk for complications or death from COVID-19 normally work the polls. So those people were taken offline, and so we're really struggling to have enough poll workers. So it's not even just the public health aspect of this, it's looking at the ability to support this condensed election, and also the additional personal protective equipment and social distancing and other measures that have to go into place to protect everyone from being exposed. And we anticipate, this is why our peak got moved up, because at first the University of Washington study said our peak would be at the end of April, but now it's saying April 17th. So we assume, okay, maybe it's because they're looking like they're still going to have the election. They're Wisconsin, what's going on with Wisconsin, and we're still doing this. So it's very, very disappointing. It's very anti-public health. And we are very concerned of the strain and the surge that this is going to cause the healthcare system and the loss of life.
Just a quick remark about whether or not you would consider doing one of these in Spanish from Jeanette. Jeanette, I will just throw that out there as one that maybe they might need to talk about before they can give you a definitive answer on that. But we've had that recommendation a few times, just so you guys know.
Yeah, I would love to do that. When I started my public health career, I used to work at the Southside Health Center, which is a health department clinic. And although I'm not Latina, I often get that people come up to me and they start speaking to me in Spanish. So I had to learn Spanish very quickly. So it'll be just a little dusting off of my Spanish, but I think I could pull it off.
Very good. Ashley is relaying a question from Kevin. Starting to see some communities talk about imposing a curfew. While this won't affect me, since I have no place to go besides home between 9 p.m. and 6 a.m., I was curious how a curfew would tangibly aid in preventing virus transmission beyond the current stay-at-home order.
So curfews can be very effective. Whatever you can do to reduce the congregation or the opportunities for infection would be very helpful. There's some schools of thought of, okay, we're flattening the curve, we're attempting to flatten the curve, which is why we have these executive orders and other local orders in force now. But like smashing the curve is a more aggressive position where it's like very rigid restrictions on movement. So no exceptions, like everyone's staying in for like at least 5 weeks, and then that would snuff it out. It's kind of like snuffing out a fire and removing the oxygen, right? So we know that that's very difficult because we have a number of people that are considered essential that still need to go out and about, that still need to use public transportation to get to work. We've been logging a lot of complaints, to be quite honest, with the bus system and people not honoring social distancing. So we're dealing with some things like that. I don't want to shut the bus system down because I know many people rely on it to get to work. However, when we start looking at the epidemiology a little bit deeper, is the bus a way that people are getting exposed? So those decisions would be made, but curfew enables you to shorten some of the time and still allow people to go to work and do what they need to do, but it's really going to address some of this loitering and some concerns we're seeing in various parts of town. So it's not out of the question we would issue a curfew.
I can also speak a little bit to that, just having several family members who live in Puerto Rico and where they do institute a curfew between the hours of 8 p.m. and 5 a.m. And it does limit the amount of essential business and how do you enforce that. But depending on what the risk is for the community and the type of loitering that Dr. Kowalik had mentioned, for certain communities, it may actually be effective, but it's a lot more aggressive measure. It's a lot more draconian. You hear that term in the news all the time now. So if we can get away with flattening this curve without taking those drastic measures, obviously that helps our community feel a little bit more liberated.
Very good. One more quarantine related question, and then I'll move on to some takeout food questions. In my community, there are get-togethers and party-like activity like normal. Is this a crime that should be reported?
Oh, we've already gotten those complaints in pictures and people sending Facebook posts and all of that. Many of us, you know, what is a law if you don't enforce it? And our issue is the bandwidth to be able to enforce and police what's happening at the household level, if you will. So we are looking at some of that, but we also know our first responders are focusing on other things, but we're trying to kind of ease into having a more heavy-handed enforcement. But we also know that you give people warnings and then eventually you got to do something. So that's where we're at right now, is easing into more strict enforcement.
Lynn asked the question, does MCW have an antibody test, and are you testing frontline providers and staff?
I can
We at the,
speak a little. Go ahead.
you want to go ahead, Joyce? That's fine.
Go ahead.
We can do the antibody test, but it's not as good as the RT-PCR test, the test for the virus itself. And there's a lot of questions about the antibody tests that are going to be coming on the market. So the answer that we give you next week might be different than what you hear today, but everybody's working really hard to bring those to the front line.
Right. Very good. We've got a question from Jerry. Has the Milwaukee Health Department considered aggregating hospital data to better inform our community? Data such as number of ICU beds available, number of vents being used, number of total hospitalizations. Without this aggregated data, our residents do not understand the full public health impact.
That's a great question. So that has been being managed through Dr. Ben Weston, who is the medical director for emergency management for the county and the city. He's also very involved with our emergency response efforts. We have a unified emergency operations center, and we meet quite a bit, but there is tracking of number of beds, number of ICU, and number of ventilators and all of that. We use EMR or EM Resource, and then we also are working through the Milwaukee Healthcare Partnership to consolidate information and have more up-to-date information. This is why this additional site was added that will be at State Fair Park to provide some supplemental support for our healthcare system here in Milwaukee. And then working on getting that up to speed. So we're using a lot of math to come up with projections of what we'll need, and then using alternative site and assistance from the federal government to make sure that that is available when the surge comes.
Question about takeout food. You say you can get infected by mouth, nose, and eyes, yet we hear that takeout food is okay. When you say through the mouth, is that inhaled as opposed to ingested? And that's from Sharon.
We were, I can
answer
that? We were just having this conversation over where we were going to get takeout with my family yesterday. And I guess the quick answer is if you're going to an area that is, or getting takeout from food from a restaurant that is aware of the infection prevention practices where the personnel are wearing gloves as they handle food, washing their hands with soap and water, that they've undergone thorough inspection, and they have a track record of food safety, then I think you're probably okay. Do we know 100%? Of course not. Do we think that's a major mode of transmission? We don't have evidence to suggest that yet, although we're still learning and things change second by second, seemingly. I think it's still important to support local businesses and to call ahead, and if they have a curbside pickup as opposed to picking up the food inside the restaurant to minimize the risk of exposure, that's going to be preferable.
Lots of questions.
And the health departments, all over, just to touch on that, so there's consumer environmental health sections, which is basically food inspection. So they definitely go out, you know, we have a food grading system here now, but looking at cleanliness and practices and providing education to management of what to look out for if staff appear to be under the weather, and making sure they're not keeping staff that are sick working, that they're sending them home, and that they're, you know, making sure that they haven't exposed other people in the workforce.
Very good. Bunch of questions about communities of color. We'll kind of group them together here. Seeing that these cases correlate to the disenfranchisement of communities of color, particularly Black, and the low rate of reporting for Latinx communities, particularly undocumented, what are the steps that will happen now and after this pandemic to address these health disparities?
Well, we're very concerned because whether this was an outbreak, natural disaster, any type of major event, when you have groups of people that are chronically disenfranchised, inequity in pay and types of jobs, where people are able to live, education, you name it, there's going to be a more significant impact on whatever that event is. And we're seeing this play out right now. This is why it's important to measure race and ethnicity in this outbreak. But as far as commitments to right the wrongs of the past, that's definitely the role of government as well as private sector to look at what can be done, what kind of reparations or additional supports can be provided to communities that have suffered for a long time, that don't have the nest egg or the rainy day fund or whatever else to help them get back on their feet. So there's going to need to be some financial investment as well as investing in the health of people, because this is a very traumatic experience that we're all going through. But for other people that don't have consistent health care, that they may not have health insurance or a medical home, what about mental health? What about the people that are self-medicating and using opioids or various substances or alcohol and causing more harm because they're trying to get through these tough times? So there's going to be a lot of work that needs to be done. And there needs to be, we're putting a lot of money into now, like dealing with the actual event, but there will also need to be a surge of resources directed to individuals and communities that will have a hard time picking themselves back up after this is all said and done.
You got a bunch of hearts on that, Doctor, just so you know. A bunch of people like that remark. Question from Danae. How is the CDC visit to Milwaukee and neighboring suburbs helping to provide data and information regarding unusually high COVID-19 impact on African Americans?
So it's always a joy when the CDC comes to town, even if it's during an outbreak, because they're going to bring higher level expertise and support. So that's exactly what's happening. The CDC reached out and they wanted to do a household transmission study. So they're looking at how COVID-19 moves throughout the house. So say if you have COVID-19 and you're in isolation, they're looking at a variety of features, people's home environment. Not everyone has their own room that they can just be in, their own bathroom, like having to share space, and how does the disease manifest throughout a household. So that's what that study is about. And there are other health departments that are involved in this study. So North Shore Health Department, which represents 9 jurisdictions in Milwaukee County, and then the Wauwatosa Health Department, which is west. So it'll be a nice cross-section of more affluent parts of town, parts of Milwaukee County versus the city of Milwaukee. But just getting some additional insight on how this moves. Again, we're waiting for a vaccine. We're waiting for a quick fix to COVID-19. So in the meantime, we're looking at basic preventive measures that can be done to reduce the spread, like the question about the food, for instance. Like what are some things we need to know about COVID-19 to help people limit the spread within their house? So more to come on that. I don't know when the study will be done, but I know they're recruiting away and then assisting with case investigations.
Question from Deborah. My concern is our jails and nursing homes where the population in each are helpless. Are the experts on top of this and advising elected leaders of how this might overwhelm our hospitals as infection rates increase?
Sure. So the long-term care facilities and incarcerated individuals were added to the testing criteria, the most current iteration of the testing criteria or guidelines from the state, because they recognize that congregation is a way to spread COVID-19. So even right now, there is an outbreak at the House of Corrections, and then there's an outbreak at the city jail, meaning one case. So like what is being done to contain that is very important to make sure that those individuals are not exposed or removing them from the environment. So you're seeing some of these campaigns to remove or allow people that are not violent offenders so that they're not being exposed. And then also for long-term care facilities, making sure that the individuals that run those institutions, that they are monitoring and limiting or prohibiting visitors, that they're screening staff, before they come in every day, so that they're not coming in infecting the rest of the nursing home or long-term care facility. And what we also know is that we have a number of people that pool. They work in long-term care facilities all across the area. So you could have one person that's COVID-19 positive, and they're going to 2 other long-term care facilities and spreading it. So what is being done to manage that is very concerning. So the screening of staff, the education, this is why like having more widespread testing would be very beneficial, especially for that workforce, to protect our vulnerable people that are living in these situations. We again have had a number of older people that have passed away due to COVID-19 infection. So we really have to protect and make sure they're not being exposed.
Question from Kimberly. How prepared do you feel our local hospitals are to meet a surge of COVID patients? I recently saw that Aurora Healthcare parked a refrigerator truck outside their facility to handle possibility of too many deaths, which doesn't promote confidence of the public.
Dr. Martin, do you want to take a stab at that?
Sure. I can't speak for all the health systems for sure, but I can say that our primary clinical partner here at Crater Health has been working very hard to prepare for a surge of patients that we expect in the next 1 to 2 weeks for sure. And as I've heard from some of my colleagues elsewhere in the organization, the other health systems like Aurora and Ascension in the area are also doing similar measures to make sure we can accommodate the patients that we expect to show to the emergency departments in the next 1 to 2 weeks.
And kind of a related question from Allison, have methods been put into place to ensure sufficient trained and qualified staff and vital medications will be available to care for COVID patients? Basically, what are the surge plans for respiratory therapists, ICU nurses, providers, and pharmacists? Will we run out of qualified staff before we run out of ventilators?
I think the answer to that is no. We've been working very, very hard, and by we, I mean the whole community, to try to make sure that we're able to help each other when and where we need to. People have been already started to cross-train so that they can go across disciplines to help out where needed. And I know Dr. Sanchez has been involved in some of that planning.
I can comment a little bit more. At least as of now, there are several phases that at least our enterprise has taken into cross-training staff and to prioritizing grabbing people who are board certified in certain areas and may not have practiced in critical care or in hospital medicine, but ensuring that they have the training in place so that they can provide the best care possible to our community. And that's from the physician and nurse practitioner and residents, and from that level. I can't speak to respiratory therapists or physical therapists or some of those other disciplines because I'm not involved in those conversations, but certainly at the physician and advanced practice practitioner level, we have the bandwidth and we have a system in place to deploy when necessary.
If I could just put in a pitch for Medical College of Wisconsin and our partners, Freighter's the busiest hospital in the state, and we have the largest specialty practice of physicians in the region here. And so we feel well prepared. And again, just working with the other health systems, everyone's taking it seriously. They're learning lessons from New York and New Orleans to make sure that we're all ready. And I can assure you that we are.
I have a couple of softer questions. There were a few surge questions there that I wanted to make sure we got in, but a question from Erica. Do you know if individuals who wear contact lenses are more at risk given the hand-eye contact that's required?
Good question.
Dr. Sanchez?
Sounds like a study.
So I can speak to that. As long as you're performing sufficient hand hygiene with soap and water, I think the risk of that is minimal. For the most part, it's very, very hard to remember to wash your hands with soap and water for 20 seconds unless you're intentional about it. I personally don't wear contacts. My husband does. Sorry, I keep bringing my family up. I can't separate family from this pandemic because we're all in the same situation here. but doesn't wear contact lenses anymore. He wears glasses because it's a lot easier to allow him to not touch his face. So whatever is feasible for you. If glasses are prohibitive, if you can't see, if that increases your risk of falls, by all means use your contacts. Just make sure that you're performing that hand hygiene that we recommend.
We've got Ada asking, if the people in the state have been staying home for 2 weeks, shouldn't we be seeing a decrease in cases soon?
The simple answer is yes, if we keep doing what we're doing, but there's going to be a peak first because people don't have symptoms. They can be contagious, and it may take up to 2 weeks before we really even see somebody that's infected. So what we do now, we'll be seeing the effects of that in a week or 2 weeks. So there's a lag time in between. The cases are still rising every day, but the rate of the rise is lessening. And at some point, we're going to reach, I hope, a good, what we call a tipping point or inflection point, where the number of cases start to go down. But that's probably 10 days or 2 weeks ahead of us.
Yeah, and the other point too is looking at adherence or compliance with the orders to stay home. And we're looking at like technology to track, like using cell phones, for instance. Are people really staying at home, or are they going like, maybe to the grocery store near their house or something like that? So there's Google Analytics that can help provide some insight for that. Some of that information is really helpful to look at how an order is being followed, but we also know that there's barriers to following orders where, if you're an essential worker or maybe you're caring for family members or something like that, where you're not able to just stay at home. So, it's cool to use technology to see, because I know years ago we didn't have that ability to use technology to track adherence to orders.
Question from Amy. I have a friend that owns a cleaning service. She would like to know if a vacuum cleaner will cross-contaminate into the next house.
That's a tough one. I don't have an answer for that. I just don't. Theoretically, if you're using a vacuum cleaner that cleans with soap, the ones that deep clean, for sure, you're not going to be cross-contaminating. No one's ever studied that, as far as I know. Is it theoretically a possibility? Sure. Do I think it's going to be a major factor? Probably not, but I don't think we know that for sure.
Well, and then you look at the lifespan of COVID-19 out of a host, right? So that it varies by the type of surface or material, and that it could be 3 days. So it's like, how are you, rotating the machine in and out per se? Are you emptying it outside, or using bag type of a bag vacuum or something along those lines? So it's definitely something that should be researched a little bit more, but it's a good question.
But I'd imagine that the bigger concern is your friend going into the houses of folks who may have the virus and coming into contact with the actual people or with other contaminated surfaces that we know the virus can live on for hours or maybe even a day or so. So I think he or she just needs to be very mindful of that, more so than the vacuum cleaner issue.
Just kind of putting that together with a couple other questions.
At least they're cleaning.
That were similar. An anonymous question: can the virus be transported by wearing street shoes in the house?
Potentially.
Well, I'm old-fashioned. I think you should take your shoes off at the door. So I do tell people that anyway.
We have another vote, this time from Daisy, for having one of these for the Spanish-speaking community. So thank you in advance for doing that, if that gets done. Questions about groceries and food. There are a lot of recommendations about what to do when bringing in groceries, such as leaving things in your car for 1 to 3 days, or wiping down food containers with a disinfectant before putting them away, because the virus can live on paper, plastic, etc., and washing fresh fruits and vegetables with soap and water. What, if any, of these recommendations should actually be done?
Well, I like the idea. I don't like the idea of leaving groceries in your car to 1 to 3 days, pandemic or not. But I do think it can be wise because we know the virus can live on surfaces for hours or maybe even a day, to wipe down delivered items or items from a grocery store with an alcohol-based solution or with soap and water.
And I would definitely wash your hands after putting the groceries away, and then wipe, the handles, the doorknobs, and things like that. Anytime you're bringing in anything foreign into the house. But my understanding is COVID-19 can last for up to 24 hours on cardboard or paper. So I've heard of people, washing their money and sterilizing their money and things like that. So.
Related question. Sources say that it's better to get groceries delivered than to go to the grocery store. If I wear a mask at the store and wash my hands, isn't that safer than having someone I don't know handle my food?
Probably.
Seems legit. Yeah.
I think the latter, where someone is delivering your food, that's the unknown variable here. So if they're a public health officer, if they're Dr. Kowalik, I'd feel very confident in that. If it was my 6-year-old, no.
Right.
With about 12 minutes left on our clock, I'm going to shift gears to a different set of questions. Danae asks, as COVID-19 reveals opportunities for even greater collaboration between healthcare systems and trusted partners in community, will there be a prioritization of exploring partnerships to effectively address health disparities?
Yeah, I think this COVID response is definitely bringing some new players to the table that sometimes in our community, we tend to go to the same people. So there's new energy, there's different groups, different people that have been surfacing to help battle COVID-19. So I think that's also going to set the stage for some new partnerships and innovation in how we deal with equity in the city of Milwaukee and Milwaukee County.
And I also direct that question to Dr. Raymond. You've been kind of ubiquitous all across the community, talking to a very broad and diverse range of stakeholders. How are you thinking about MCW's relationship after this as it relates to some of these other community participants?
As Dr. Kowalik said, we're all making connections with people that are trying to do the right thing. And we've met some really outstanding community-based organizations that we would like to build bridges to and to be an ally with going forward. And Corey, as you know, because you've been a champion of this, MCW already had committed to moving back to Central City, Milwaukee with a large contingent of our faculty and staff, and that's a generational commitment. So the more partners that we have, the better allies we can be and the better asset we can be to all the communities here.
Thank you.
Related to that, Harold asked, what will Milwaukee do to prepare for the next pandemic?
Well, that's definitely Dr. Kowalik's question, but I would say I hope that the health systems figure out how to have a stockpile of pandemic ready ventilators and gloves and personal protective equipment.
Yeah, that the national stockpile actually rotates out the stock so you don't get old things that you can't use. But as far as public health, as you know, the Milwaukee Health Department has seen better days, right? So the whole reason why I came back home is because the department was in rough shape and needing to come in to help move the department forward again. So that process is still going on. This is definitely not a good time. There's no good time for a pandemic, but definitely now is not ideal. So having the department back up to optimal levels, staffing, competency of staff, systems being accredited, having an electronic health record, like moving from paper to more innovative technologies and things like that. I mean, all of those things are really important to help us to brace for the next outbreak, whether it be a vaccine preventable disease, which is something we were bracing for because we know that there's an anti-vaccine movement in this country, whether it be a tornado or some other natural disaster that would cause a lot of loss of life and a lot of chaos in the city. We were preparing for the Democratic National Convention, so there was a lot of federal assistance that was coming in to really help us get up to speed with emergency preparedness. So just like going through these exercises and building the department back up to be able to withstand the rigors of an outbreak, and we're going into week 4 now, and it's going to be a long summer. So it's trying to keep staff, work-life balance and wellness and just everything that goes along with a pandemic response is a lot. So I just again want to acknowledge the health department staff as well as all of our healthcare partners, because we're all working on this together, and we all have to make sure we're shoring up our home bases so that we can withstand the storm.
And I'll just add to that, I think all our health systems are learning some important lessons during this pandemic that we'll be able to take into future pandemics. I think to get back to something Dr. Kowalik said earlier, I think one of the other really important things we're going to need to do to be better prepared for future pandemics is to address some of the underlying disparities that we see in some of our communities of color. It's clear now in a way in which perhaps it wasn't before that these sort of natural disaster events, they exacerbate the pre-existing underlying disparities in communities. So we need to give some attention to that too.
Question from Rosanna, and then an anonymous question, which is related. Do you believe that students will go back to school this year? And the anonymous question was, should the DNC be canceled entirely or taken online?
Ooh. Well, Dr. Posley, the MPS superintendent, has already stated that the school year's over. I mean, it's going to be remote until the end of the year. So I don't know about other jurisdictions, but just this disruption and to bring kids back on, it's just a lot. So I'm just finishing out the year. And then as far as the DNC, I'm very happy that they delayed it to August. But is that even going to be enough? I mean, COVID-19 in some parts of the world have a second wave. So once we get through this first one, is the second one going to hit? So, maybe going online. I'm preparing for an online DNC is probably smarter because we don't know what's going to happen.
Corey, you posted into the chat a question from Nina. What thought has been given to providing support now for people with mental health issues, and what additional support do you envision being needed after the crisis has passed?
Ian, did you want to talk about some of the things that you're doing with our Department of Psychiatry?
Yeah, I think this question, fortunately, we had some lead time with this, with the knowledge that Milwaukee County will be closing the behavioral health center here at the Milwaukee County Regional Center in a couple of years. We've had an opportunity to think internally how we would help address the need of patients with psychiatric illness around the county and work with many of our other health system partners to do that. Some of the things that we've done here on campus, we've partnered, so my Department of Emergency Medicine has partnered with the Department of Psychiatry and Behavioral Medicine to create a set of embedded psychiatrists actually in the emergency department to help with disposition of patients, but also to initiate treatment of these patients sooner. Some of whom might have needed to be admitted formally now can be discharged from the emergency department, or some that may have needed to be admitted to the highest level of care can instead go to a lower level of care. So that's just one example of initiatives that we have underway here at Freighted and the Medical College to address this important need for the community.
Just a comment quickly from Jerry, and I think he expressed it well for a lot of people who've commented. Thanks to all of tonight's MCW and MHD participants. This has been very informative and important and appreciates your time. Please stay safe. Question from Beverly. if you have a family member that works in the healthcare industry or another family member that is pregnant, should the two of them be completely separated, or is it okay for them to be in the same room as long as they're following the social distancing rules?
I can start because we've as this pandemic has evolved, we've reevaluated almost on a daily basis what our family should be doing, since we have 3 healthcare workers who are returning home every day to a 97-year young grandmother and 2 small children. So at this point, we're not isolating ourselves, but I know plenty of people, mostly in New York, where the pandemic's really hit the most, at least as of today, that are completely isolating themselves. Not every healthcare worker has a family, has a home that is amenable to isolating themselves. So I think we're all doing the best we can. And if you have the ability, both from a space standpoint, but also from a mental health standpoint, not just for the health provider, but for the other people involved, small children or older individuals who need care. I think if you take all the proper precautions in terms of hand washing, leaving the shoes at the door, changing clothes, particularly if you're on the front line, and keeping away if you get sick, absolutely keeping away from anyone if you get sick. I think that's the best we can all do at this point.
Probably have time for about 2 or 3 more questions, so we'll go to Mikal. What steps is MCW Freighter taking in regards to protecting physicians in the high-risk age group of 60 and older? Are they being offered the option to take leave or work from home?
I would say that, and Ian and Joyce, since they're working in the hospital, probably know more, but part of our workforce plan is to try to protect vulnerable healthcare workers, but it may not be entirely possible to do that in every specialty. And all of us swore an oath to try to help people. And I think you're going to have to hold some folks back. They're going to want to be there on the front line doing everything they can.
Yeah, that's, certainly my faculty and residents and staff are certainly on the front lines of this. And we've sort of had the opposite problem where folks who might fall into that category certainly want to be a part of this pandemic response. And so when we have staff or faculty who have special needs or in high risk categories like pregnancy, that came up in the last question, we make accommodations so that we make alternate work accommodations for those folks. But like I said, it's mostly been the opposite, where people have insisted on being a part of the care of patients during this pandemic.
I think most healthcare workers, whether they're in leadership positions or not, are very sensitive to one another's needs. This is a vocation. This is a career that we're passionate about, and we want to extend that care to each other. So I've seen nothing but very good support from everybody, from janitorial staff who come to the hospital, being friendlier and smiling more, to the highest level leadership on the executive level. So I agree with Dr. Martin. If anything, it's the folks who maybe older or have other comorbid conditions who really want to be on the front lines, and assessing from department to department and division to division on what the resources are and being supportive of one another.
We have the same situation where we have staff that are considered high risk because of age or underlying health conditions. I mean, even myself, where they still want to be out and working in a clinic and doing things, and we're like, no, you need to be offline. There's other ways you can help. The health department has a alternative work schedule and telework policy, so we have expanded that to include all employees. And there is more than enough work to do. There's, different ways to provide assistance during this response. But then there's still other things that still need to happen, just like at MCW or any other healthcare provider, where there's still other essential services that need to be met. So you still need to see, if a patient is pregnant, there's still appointments that need to happen. So there's other things that need to go on that we can't just suspend everything and just totally move everyone onto COVID-19 response. So we have a mix of people working on the response and then people that are holding down the fort, making sure other essential functions are happening.
Very good. We're about out of time, everybody, but Mara Lord, Dr. Raymond's and et cetera's colleague from MCW, sent me a text message while you were speaking. Eric, can you please announce that both MCW and 16th Street Clinic will be hosting webinars in Spanish coming up soon, and we will send out information tomorrow about that. And then also that they're looking at doing town halls in other languages as well. So for everyone's information. And doctors, I'll turn it back to you all, but there are a couple dozen more questions that we're not going to have time to get to. Is it all right if I can say out loud that I'll be sending those into you guys, and you guys can put those into consideration for your next event?
You'd be
Thanks,
happy to.
Eric.
Okay, thank you very much. Final remarks, and we'll close her out.
Well, let me thank again our panelists for being here this evening, Dr. John Raymond, Dr. Ian Martin, Dr. Joyce Sanchez, and Dr. Jeanette Kowalik. We appreciate all of your leadership in helping keep our community safe through this crisis. And on behalf of our entire community, we thank you for your great work, and we ask that you keep yourself safe too. So thank you to all of our participants. We hope you'll have a good evening and hope that you'll join us again at our next town hall. Good night.
Night.
Bye. Thank you.
Bye. Thank you.